From the beginning of time, humans have tried to heal themselves with ritual and prayer, and with whatever nature provided. Through thousands of years of trial and error, formal systems of healthcare developed, systems based on foods, herbs, and other natural remedies. These systems live side by side with what we call Western medicine. Western medicine has been an enormous benefit in helping to conquer devastating infections and perfecting surgical procedures. But there is more to medicine than doctors and hospitals, and that's exactly what we'll explore this week on A Better Way to Health. Hello, I'm Stuart Shipe, a registered pharmacist, acupuncture physician, and Chinese herbalist. I'm your host this week. We make no effort to recommend or to judge, only offer that you explore a theory that good medicine comes in many forms. So let's get started. Phone lines are open for you for questions, comments, or experiences about your health. Let's hear from you.
All right, folks, another week, another show coming at you, and I'm excited to get going today. We have a lot of information to give you about how to bring natural medicine and ultimately great healing into our lives without the need of a lot of surgical interventions, without the need of a lot of medications. God, wouldn't that be a wonderful world if we actually were able to heal naturally again, instead of our dependence so heavily on a biomedical kind of paradigm where drugs, surgery, therapy become the pinnacle of healing, when we really kind of sometimes are fooling ourselves that, albeit that we don't have participation in that healing, we ultimately have to have participation. And that's where Chinese medicine today and natural medicine is going to take us down a journey of the treatment of a devastating problem that isn't life-threatening, but certainly it's been termed skin diabetes, and you may have never even heard that term, and we're going to tell you about why it's named like that, but why this specific problem, namely acne, is such a plague on our younger generation and sometimes even into adulthood, where we really haven't found the real true reason why we have such a horrific skin condition. You know, when we look at acne, I'll start off with my own personal story and give you a little bit of insight as far as what I went through as a young kid. I remember in high school walking around and seeing mostly men. You know, acne, unfortunately, is higher incidence in men than in women, but certainly afflicts both genders. Is I can remember kids with acne, not that they were outcast, but it seemed like you were a little bit inferior. Why did it have to happen to me? And certainly weighed heavily on the mind of a lot of teenagers. Anxiety, I know it did with myself, because I couldn't figure out what I was doing wrong. You know, the treatment, and I'll go through that at the time, was suboptimal. It was the disease is recalcitrant to keep on coming back. And I remember actually going into college. I used to do a lot of swimming as a lifeguard at University of Illinois, Chicago Circle. And in that environment, I never was realizing how much chlorine was probably affecting the problem, damaging my skin in the wake. But it wasn't until I started a drug, and I went through, folks, all of this stuff. I was in a dermatologist office every other week doing photo light therapy, standing in this photo booth and getting irradiated with ultraviolet radiation. And the thought of that was, yes, sunlight does help. In fact, it's shown that acne is worse usually in the winter months and better in the summer months. Maybe not due to the heat or cold, that like a pattern like atopic dermatitis, like an eczema, would be affected, where sweat makes it worse. But certainly you would think that the summer heat and sweat would aggravate that condition for sure, right? So it was in college when I was lifeguarding that I got in touch with a gentleman that told me, hey, you know what, you should talk to your doctor about this medication. And it wasn't even out yet. It was investigational, called Accutane. And he goes, you should talk to your doctor about that, because, you know, unless you still want to do the photo booths and the injection of steroids into the comedone or into the nodules, oh my gosh, what I went through, or the persistent use of tetracycline and all of its derivatives, minocycline and erythromycin, which definitely can be toxic. Even as a pharmacist, I can tell you, out of all the medications that I would not take for sure after the expiration date, other than Tylenol, would definitely be a tetracycline family drug, because the drug literally breaks down after the expiration date into toxic metabolites. And that's something, folks, that I know a lot of you, well, I'll just take a little bit of the antibiotic until I feel better, and then I'll just save it in the kitchen cabinet for a remainder in case, just in case the infection comes back, I can use it again. Bad idea. Not only bad idea not finishing, but bad idea taking a medication again without medical supervision. So my story ended up, went to the dermatologist and asked him about the medication, and he said he doesn't have anyone on it currently, but if I would be willing to be a part of a guinea pig, an investigational study on it, he could get the product and I would be in that study. So I agreed. And at that time, boy, oh my gosh, it was like a miracle. I will tell you, folks, upon taking the product, within a couple of weeks, I could see really good reduction in nodules and acne presentation. But man, I paid for it. Cheilitis is a dryness in the lips, where my lips were cracked open, bleeding. My eyes felt like as if I was closing them with sandpaper on board. It was terrible. Dry skin. I felt like I was being sucked dry from the inside, from the outside in. And oh my gosh, that lasted for months. So the thing I should have probably kept in note was, when I started the therapy, the physician wanted to do liver enzymes very quickly. And I was like, why would you want to check my labs before I start the procedure? And the reason for it is because this drug is disastrous as far as toxicity. And we're up in dosing it to, and some of these very severe cases, we're already in toxic dosing, and it definitely can hurt the liver. So they check liver enzymes just to make sure that you can still remain in the therapy without nuking your liver to death. So, I don't know why the dependence today. Well, I do know why, for a number of reasons, practicing in pharmacy for many reasons. Now, on the other side of the fence, looking at so many beautiful alternatives to antibiotic therapy, is from the 40s. Antibiotics were developed during the World War, and we had sulfur drugs, and penicillin was brought to the scene. And even in China, when the Western drugs, the antibiotics, hit China, oh my gosh, they thought it was magic, how quickly someone's infection can be healed. And rightly so, amazing discovery. But since that time of good jurisprudence and really control of the use of antibiotics only in the right conditions, we've gotten to be a culture of excesses. We're fast paced. We want a quick fix. We're a society in which we demand health and we demand access to that health, but we don't really take the responsibility required for us to really get healthy. And that might mean creating a healthy internal environment, things like changing our diet, changing our lifestyle, changing our thought processes, changing all of the relationships that we have or what we think that we have. There's so many issues, but antibiotics are really quick. They were a quick find and a quick fix for treating acne. And the problem with them is, though they were effective, and I can tell you from a personal point of view, of course they did help, the recidivism rate of the acne, the recurrence again, was very high. And I don't have a stat, but I'll bet you it's got to be over 80–90% when you stop the antibiotic, that the acne just came back. So it was suppressive for the thought of, this is a bacterial infection in the skin, so what better way to treat it than with an antibiotic, without really digging down deep into figuring out the why. Remember, I tell you every single show, I say, ask your doctor those 3 letters, WHY, and find out and investigate what's the root cause of the problem instead of just treating the symptoms, right? The diagnostics in acne are pretty easy to understand. We have open comedones. These are, I should start off with a follicle. Follicle, like what a hair comes out of, is called a follicle, a hair follicle specifically. Tiny little follicles in the skin are little pores that we have sweat coming out from. We have oils called sebum that are constantly being excreted into our scalp to keep our scalp moistened, to keep the hair luxurious, right? And to also be a protective barrier for the skin as well. So we have open comedones, these dilated follicles that have these horny little plugs, black or dark horny little plugs. I'm called blackheads, and we've all heard of that term before. Those are called open comedones. We also have closed comedones, and those are where we have little red papules, little red raised skin, and that can be with or without whiteheads. And what's happening there is you're experiencing inflammatory changes going on in the skin. When you get to a point of superficial pustules, this is where we're collecting pus inside that follicle's opening that's become trapped. And it leads sometimes to a nodule. And a nodule then becomes these tender collections of pus deep within the skin's dermis. And it ultimately goes into very large cysts. And these are nodules that fail to discharge the contents of the sebum routinely. If it gets to the point where we're talking Accutane and really aggressive therapy, these are large, deep pustules, individuals that have these nodules that start breaking down the adjacent tissue, leading to scars. And a lot of times in a lot of these kids, including myself, you're trying to express the comedone, you're trying to stop that inflammatory change, and you're only really breaking down that local skin. So literally these deep pustules just continue to grow and increase in size. It's terrible. Acne is the most common skin problem in the United States. Now, we can't say that it isn't without maybe a little bit of help from our parents, because we have found that a key factor is genetics. Acne is inherited. It's an autosomal dominant pattern that usually deals with both parents. So the statistics are, if both parents have acne, then one of four children, I'm sorry, if both parents have acne, 3 of 4 children will have acne. If one parent has acne, then 1 of the 4 children will have acne. So you're kind of double blessed with this disease process, this imbalance. If both of your parents, when they were young, reported to you that they actually had acne as well. Lesions can be on the face, they can be on the back, on the chest, on the shoulders. And I told you they were more common in males, but the reason why I wanted to bring this up as a female presentation as well is because this is devastating. And some of the medication, not only the medications, but just the incidence of depression among young adults and young teenagers is devastating with this type of presentation. Actually, if it gets worse, the acne vulgaris, increasing the size of the sebaceous secretions and the size of these glands, it can be scarring and terrible as far as the individual, the patient going through this. So the progression of this stuff, it's the $1.50 word in Western medicine is called hyperkeratinization. And what that really is talking about is the cells around that comedone become very cohesive, very sticky, and very kind of like glutinous, kind of nothing really resolves, almost like glue in the comedone. And what it's holding back is it's not shedding that skin, that keratin, into the outside of the body, and it becomes trapped. Unfortunately, with sebum, a very oily nutrient, it may not be too good for us as far as when we think about eating something like that, but to a bacteria, oh, it's heaven. So what ends up happening is the bacteria then become trapped with the sebum in the skin follicle, and then the bacteria start feeding off that food source and thriving off that food source. And there's a couple of specific bacteria, Staphylococcus albus and P. acnes. These bacteria release lipases, and lipases are nasty enzymes that break down the skin even more. So now you've got a bunch of sebum triglycerides, free fatty acids. Now you got an inflammatory portal going on in the skin, and it just gets worse. It doesn't get better. So do you really think, now think about that after I just explained that, if just using antibiotics to kill the bacteria, or attempt to kill the bacteria. Now, mind you, the bacteria are not in the bloodstream at this point. The bacteria are in the skin. You want to know the hardest place to put antibiotics or try and get antibiotics to. One is the extremities, two is the skin. And we know that even treating diabetic problems, diabetic skin ulcerations, extremely difficult in the skin, just because you don't have a really, really strong active blood supply that is bringing the antibiotic into the area. We see that problem even with sinus congestion, that we really can't get the antibiotic in high enough quantities into the area to be effective. So you start living, unfortunately, a lot of people just start living with that philosophy. I just got to keep it up. I just got to keep on the antibiotics. I just got to keep on with the injections. And I may be looking at a devastating medical treatment like Accutane, or acitretinoin is the word for it, because it's a derivative of vitamin A. And of course, we have skin changes. Maybe some of that sunlight that I talked to earlier with you, maybe part of the reason is because it's converting vitamin D, it's converting vitamin A, the sunlight, in our skin area. So we know that some derivatives of vitamin A, vitamin E are very, very good therapies for acne that we'll get to in a little while here. But why? What can we do? What do we induce it with? Like I just told you, I love swimming and swimming in a chlorinated pool. Of course, we didn't have salt pools back in that era, but chlorinated pool probably didn't make things worse, probably just aggravated my skin. The chronic use of corticosteroid medication can make acne worse. Halogenated hydrocarbons or halogens, so not only chlorine, fluorine, bromine, iodine, have all been known to excessively increase the incidence of acne or make it worse. And then you've got lithium. Some individuals on lithium as medications can make acne worse. Machine oils, and you're like, machine oils, there is no way that I put machine oils on my body. Oh, you'd be amazed. Why? Because machine oils are petrolatum byproducts. You look at any HBA, health and beauty aid product, and you look at some of the ingredients, and they might have mineral oils in there, or like I said, these industrial oils hidden in the skin product, or in the fragrances that you're wearing, or the body lotions that you're putting on. I even look at things like coal tar derivatives for people with psoriasis. That when I was a young pharmacist, that was kind of the bomb as far as a treatment, is giving someone coal tar shampoos, to try and treat the psoriasis. And now I look back at how toxic that was, in daily use. So coal tar derivative is another toxin affecting the skin, causing inflammatory changes there. And then again, cosmetics, overwashing. It's like you just want to scrub the acne off the back, the chest, the face, and you use these these young adults using these very aggressive pads and rough type of elements to try and to scrub the acne off. And the only thing you're doing is you're aggravating the skin and you're causing more damage. And then just repetitive rubbing, keeping the face, the hands away from the face, and constantly rubbing or constantly manipulating these comedones, nodules, and pustules, probably the worst thing to do. There's problems that go deep as far as hormonal changes. And why would you think that more males instead of more females would have acne? It's because there's some endocrine changes. Acne is an androgen-dependent condition. Androgens are male hormones, namely testosterone, dihydrotestosterone, DHT. And so if you have excess androgens, they control the sebaceous output of the glands, and they can exacerbate this hyperkeratinization. Remember, I told you the trapping, the coagulation of tissue that is supposed to be naturally expressed outside under the skin, this keratin that actually is helpful for building skin and skin cells. And you probably have known it very, very well by collagen, which actually supports the keratin layers of the dermis. So when we have endocrine disorders that produce excess androgens, they induce the acne's development. Now, when do you think, what I always heard too is like that all male prostate cancer is related to testosterone, to excesses in testosterone. I was like, if that was really true, just kind of think about that. What age is the highest level of testosterone androgens being secreted at? Well, about 11 to 14 years old. I'd probably stretch at 11 to 16 years old in a young male. That's when they have the highest levels of testosterone. So if that was true, that testosterone was really the root cause of prostate cancer, then why don't 14-year-old boys have high incidence of prostate cancer, right? If that was really the key. But unfortunately, these young males have huge amounts of androgen excess, testosterone excess, and it really plays havoc in a young man's presentation with acne. Now, in ladies, unfortunately, yeah, you're catching up really, really quickly because there's other endocrine changes. And this is going to blow your mind today after I give you this information about just changing the way we think about treating just not only acne, but all skin conditions. PCOS, so polycystic ovaries, in a young woman, we found that there's a direct link to PCOS and increased in acne. Why? Because we have an androgen excess. We're thinking that the cysts are being driven by testosterone. And we have free testosterone levels occurring. Why is that? There's a little known biochemical reaction that I don't even think a lot of Western allopathic doctors know of, unless you really have to dig for it and stay current and continue education. When you eat carbohydrates, an excess in carbohydrates, your body produces a hormone called insulin. And insulin is supposed to be not supposed to be, it is very, very helpful in trying to get that blood sugar that you just got from all those carbohydrates into the cell to feed the cell. But when insulin is released, there's also another hormone released, actually a couple of hormones released. And one of them is insulin-like mimetic hormone. The other one is called a growth factor, an insulin-like growth factor. So when you have this insulin-like mimetic hormone, it looks like insulin, talks like insulin, walks like insulin, but it's not insulin. What this hormone literally does, it binds up another hormone carrier. And this carrier, kind of think about this as like, you got a lot of cowboys and a lot of cowgirls in the ranch, and you need to get them around the track, around the body. How do you do that? You put them on a horse. So a horse carries a cowgirl or carries a cowboy, whether that hormone is testosterone or estrogen or whatever that is. There's something called sexual hormone binding globulin. This is a horse that specifically has the preference for just carrying cowgirls, testosterone, and cowgirls, namely estrogen, and cowboys, testosterone, in the body. What happens is that insulin-like mimetic hormone binds up that horse's number of seats. No cowgirl or no cowboy can get on that horse if there's no seats on the horse. And what ends up happening that instead of a bound testosterone that doesn't create physiological effects because it's bound up, it's connected with a protein, it's now allowed to be free. And we have higher levels of free testosterone going on in our bloodstream, which, as I alluded to, are not conducive for reducing acne, rather increasing it. And we have receptors for growth hormone, and insulin-like growth factor is the other hormone that literally is released in response and reside actually in that sebaceous gland. So we actually have these receptors for insulin-like growth factor and other growth factors literally at the pore receptor. So when we have that, they reside, since they're residing there, they're going to enhance the excretion. Because remember, I told you that testosterone or androgens enhance the secretion of this sebum, this oily, waxy constituent, like a triglyceride onto the skin. And this growth factor is increased sebum production, acne at its highest. So then the goal would be, right, if you really want to start managing acne from a non-pharmacological point of view, without antibiotics, without anything, what's the number one thing to do? Reduce the intake of carbohydrate, right? And we're going to get to that after the break here. But if you really start looking at the simple things, this is where that responsibility is going to come in, with taking responsibility for your health and not depending on relying only on pharmaceuticals and therapy and surgical procedures. We can get to a couple of those, but anyway, then you already got the game mastered. You're already thinking where I'm at is the why. So we're going to talk about nutrition. We're going to talk about treatments. We're going to talk about minerals. We're going to talk about so many. We're going to talk a little bit about these procedural treatments in Western medicine, but very, very little. And then finish out with Chinese medicine, because Chinese medicine actually mirrors, and it's a beautiful treatment for acne as well. So we're going to take a short break on A Better Way to Health. Give me a call at my office. You have questions, folks. You want a consultation. You want to evaluate, what can I do about my current situation? Maybe not acne, but another condition. Give us a call at 772-398-4550 or online at traditionalchinesehealing.com. We just click the link that says I want a consultation, and we'll get you going right away. I will be right back on A Better Way to Health after this short break. I'm Dr. Stuart Shipe.
You're listening to A Better Way to Health with me, Dr. Stuart Shipe, lead physician at Women's Traditional Chinese Healing. To book your consultation, please call 772-398-4550 or book online at traditionalchinesehealing.com. Ladies, your time has come. No longer will you be a slave to drugs, sleeping pills to put you out, caffeine to wake you up, pills to ease your pain, hormones to regulate your cycle, addictive drugs to calm your anxiety, and antidepressants to lift your mood. Find the root cause of your imbalance and quit treating only the symptoms. You deserve so much more out of life. Women's Traditional Chinese Healing was created for you. Welcome to A Better Way to Health. Our experienced physicians listen to your concerns and formulate an individualized treatment approach to bring you back into balance. We specialize in women's natural health care. When was the last time you really felt amazing? If you don't remember, let us help you refresh your memory. I invite you to contact our office for a consultation with our physicians to determine if you are a good candidate for what we have to offer. Call 772-398-4550 or online at traditionalchinesehealing.com. That's 772-398-4550 or traditionalchinesehealing.com. Thanks for listening to A Better Way to Health. I'm Dr. Stuart Shipe, founder and lead physician at Women's Traditional Chinese Healing. We're a unique natural healing haven for women of all ages. Like many women today, you might feel like you're battling your body, struggling with fatigue, headaches, sleeplessness, pain, hormonal imbalances, digestive issues, allergies, and those few stubborn pounds you've put on. Western medicine often ignores the root cause of your symptoms, but at Women's Traditional Chinese Healing, we work together to get to the source of your symptoms and bring your body's function back so that you feel energized, comfortable, and balanced. If you're wondering if my practice is a good fit for you, I invite you to book a consultation by calling 772-398-4550 or online at traditionalchinesehealing.com. Again, that's 772-398-4550 or online at traditionalchinesehealing.com.
This is A Better Way to Health with Dr. Stuart Shipe of Women's Traditional Chinese Healing. Get back to living by booking your consultation at 772-398-4550 or online at traditionalchinesehealing.com.
We are back to A Better Way to Health. Thank you so much, folks, for being with me and staying with the show, because hopefully I can teach you something today that maybe you never heard before. The term skin diabetes, I started off with that. Have you ever heard of that for acne? That's kind of oh wow, how well thought out that was when someone really recognized that this pattern isn't about treating with all these antibiotics, and acne is really about treating it at the root cause, the why. Chinese medicine, I just wanted to share a slight blip with you, because I've had very, very successful treatments. You say, have you ever treated, Dr. Shipe, acne? Oh my gosh. No, we don't treat Western defined disease names. I don't treat diabetes and hypertension and obesity. These are all Western defined disease names, but I do successfully help not only the relief of the symptoms of many individuals with these type of disease names, but also am very, very successful at making sure that that doesn't come back. Because once you understand the why, you understand what caused the disorder, what caused the imbalance, Smart folks would probably want to refrain from that activity, again, unless they, are harbors for self-injury and repetitive cost, which are the most expensive, which is relief care in the United States. Just getting rid of symptoms, masking symptoms, it just doesn't make sense. So we were talking about some of the side effects of antibiotics, some of the treatment strategies that had been performed, at least on myself. The disease mechanism in Chinese medicine is interesting. It really talks about a pattern of heat and dampness. And heat in Chinese medicine is infection or inflammation in a biomedical world. And dampness is this manifestation of moisture that becomes trapped in the body. And when you congeal that dampness, those fluids, into a thick manifestation with heat, as far as kind of think about adding heat to a pot where you've got some cornstarch thickening up your gravy, and the gravy turns to solid solidification because of the heat. That's kind of what we say dampness creates phlegm. And dampness and phlegm are this filling of these nodules, this pus that develops with acne. We say these are heat evils and damp phlegm coagulation or congestion. And where does that, what's really, really unbelievable about Chinese medicine, about how they were such great observants, is the meridians, the energy channels that go directly to every single organ in the body, run all through the body. And the channels of the stomach meridian, the stomach energy highway that all this energy, qi and blood are flowing through, starts right underneath the corner of right underneath the middle of the eye, comes straight down the cheeks, comes up the jawline and right down the neck, the anterior neck, and all the way down to the second toe. So really, really long meridian. And the large intestine meridian, stay with me here, that was the stomach, the large intestine meridian also crisscrosses right across the face, down the throat, underneath the nose. And when you look at the presentation of acne as an acupuncturist, someone comes in and says, can you treat this, Dr. Shipe? And the pattern is definitely in the cheeks, in the jaws, in the neck area. I was like, wow, why is there these red pustules, right? Why is there so much, in my mind, I'm saying, why is there so much heat in the stomach and in the large intestine channels? And when you put that into context of Western medicine, you'll find that one of the indicators for the development of acne is digestive irregularity, we call it, the old term was dysbiosis. Now, we have a new term called microbiota disruption. So what does that mean? The healthy bacteria in your gut have been disrupted. They're no longer in balance. And when your digestive system is no longer in balance, then your skin is going to be no longer in balance. Why? Because the inside of our entire digestive tract, made out of epithelial cells, I call that my yin skin, my internal skin. But you know what? The outside skin is what we usually only see from a dermatological point of view or biomedical point of view. What can we lather on the skin? Lotions, creams, oils to try and treat skin conditions. The problem isn't from the skin. The problem is in the intestine being represented on the outside skin. So my term for the outside skin is my yang skin. And interestingly enough, it is composed of the exact same cells, these epithelial cells that from my mouth to my anus in my digestive tract have. So the Chinese were always great observationists. If there was something going on the outside of the skin, look inside at the inside skin. What's going on there? Is there excessive thirst? Is there phlegm? Is there mucus? Is there reflux? Is there bloating? Is there gas? Is there constipation? Is there diarrhea? Is there inflammatory bowel disease problems? Is there IBS, all of this kind of craziness. And we're wondering why we can never treat skin conditions. It's because we're not looking in the right place. So this is a pattern in Chinese medicine of this young, acne is red, acne is really obstinate. It's yang in Chinese nature, yin yang, right? It's yang, it's aggressive, it's bright, it's inflamed. So the Chinese would say this is a yang problem. Well, since young men, young boys, in their puberty are raising young, are very young in nature, they say it stirs this hyperactivity of the fire that's normally kept in the lower part of our body. Kind of, we call it Mingmen fire, but in Chinese medicine, kind of think of it as kind of like a pilot light that your mom and your dad gave you. And it's hanging down around the kidney area. I'm not going to get too deep in that. But anyways, we call it a ministerial fire. And it tends to aggravate that and flame that fire north on the upper part of the body where it affects the lungs. And the lungs then can develop heat. And the tendency of the lungs to develop heat is not a good thing, because as the lungs develop heat, this transformation of qi gets hindered, energy in the body, and the transformation of fluid, especially down to the kidney, become damaged. When the lung gets hot, where do we see the lung actually in relationship to the skin? Well, the Chinese said that we don't breathe with 2 nostrils. We breathe with 36,002 nostrils. So the skin breathes just as much as our nostrils breathe. And anything affecting the lung in Chinese medicine is going to affect the skin. So if you ultimately have all this heat rising into the lung, and you may or may not have that symptom of thirst or non-thirst, but how do you tell? Well, you can see the red flushed cheeks. That's a giveaway. That's really evident that there's heat developing in the lung. You can see the heat developing in the large intestine and in the stomach, which may be from inflammatory changes going on there. You actually start having moisture and fluids drafted upward by another organ called the liver. And when those fluids hit the lung, they congeal, they conglomerate. They go from dampness or moisture to phlegm and mucus, and that stored in the lung is stored in the skin as well. So now you can start seeing anything that heats up those juices, so to speak, in the internal body is going to congeal more and more phlegm. It's going to draft upward, and it's going to engender this thick manifestation called nodules and pustules and comedones. In Chinese medicine, we didn't have those words. We just seen the heat, and we seen the dampness that was present with the exudate that's expressed from some of these nodules and some of these very, very severe pustules. And what does stimulate that in our adolescence? Things like not unprotected, sexual overabundance, right? Alcohol, spicy foods, drugs, all activate and really hyper activate this kind of yang pattern in Chinese medicine. So of course you're going to give them guidance, give the young adult guidance, is you have, first of all, you have to watch the diet, right? And all these activities that you're associated in are too much. It's too much yang. So part of that has to be talk to them about just lifestyle modification as well, not only just dealing with the nutrition. But I'll give you one case that was one of my first cases when I really realized that this really does have to be linked. Acne is linked to higher blood sugar levels and to increased insulin levels in the body. Is I had a young lady come to me. She was probably 14, 15 years old, just plagued with acne all over her face, all over her back, just terrible. My heart went out to her when I first seen her, because I was like, I actually know exactly what you're feeling because I was there in the past. And I said, do you realize that this is a pattern, first of all, that we're going to do with nutrition? This A plus 4.0 student, she was motivated. And she did exactly what I told her to do with nutrition. We used anti-inflammatory oils like your essential fatty acids, vitamin A, vitamin D, and the essential fatty acids are extremely, extremely anti-inflammatory and great for the skin. Using calendula, which is a wonderful Western herb, neat, very, very powerful tincture, and then washing the face and letting calendula dry in the face at night. But what was the kicker? Was her diet. And she really promised that she would refrain. We gave her a listing of foods, low glycemic diet, refrain from that, increase the level of protein, increase the level of good quality fats in her diet. And you know what happened? 2 weeks, folks, later, she came back to me. Her face was beautiful. I would say 95% of that aggressive acne had already started receding. So what I'm telling you, it doesn't take a lot. You just have to find out the why. Western medicine is going to use vitamin A, very concentrated and toxic retinol. Why? Because the retinol, vitamin A, reduces the sebum production and the hyperkeratinization in these follicles. But unfortunately, it's effective usually only at high toxic doses. And like I said, you get chapped lips or dry skin, especially in the summer, dry weather, headache, fatigue, emotional lability like depression or anxiousness, and muscle and joint pain. These are all side effects of toxic retinol. And they use it internally, they use it via skin creams and ointments. And then what you got to do is you got to check the SGOT, SGPT. You got to check the liver enzymes to see if it's impacting and causing your liver to become toxic. And that's not good, right? The other thing is that we found with this amazing miracle, devastating poison is the fact that it causes unsurmountable birth defects. So that's the other thing. A woman coming in with really bad acne and the physician contemplating the use of isotretinoin, you really have to look at, is this lady going to be, is she of childbearing age? Is she using birth control? Because if not, it's absolutely mandatory. The birth defects of using retinol are high. And we learned that, unfortunately, not in time enough, when this drug was first rolled out. So contraception counseling mandatory, 2 negative pregnancy tests required before you initiate vitamin A therapy. So pretty significant, right? Zinc is vital, just a simple mineral, vital to acne treatment. It's involved in the production of hormones, retinol binding protein, wound healing, tissue regeneration. And really what I love about zinc, it's really helpful in the adrenal, the manufacturing of adrenal hormones and the immune system. So when I look at immune function and I think of adrenal, I'm also already thinking of zinc. And then it comes in many, many different types of salts, picolinate, acetate, monomethionine. But zinc is imperative for skin function. So it's kind of my #1 mineral, go-to mineral. Now, low zinc, statistically and in research, low zinc levels actually increase 5-alpha reductase inhibitor of testosterone. What does that mean in a $1.50 word? It means that if you have low zinc levels, which most young males do, if you have low zinc levels, you actually create more testosterone levels, actually DHT, dihydrotestosterone, which drives the acne. So it's lowest in 13 and 14-year-old boys. Other than any other age group, we have low zinc levels. Vitamin E and selenium. Selenium is kind of the helper for vitamin E, very, very effective at regulating retinol levels. And if most male patients with acne have decreased red blood cell counts, or actually red blood cell glutathione peroxidase levels, not red blood cell counts. So what does this mean? That we've lost the ability of a lot of treatments with, remember I was telling you about the damage that was done in the comedone, the cell, by lipases, enzymatic activity. We actually have enhanced activity and reduced control of that activity with low vitamin E levels, if that kind of made sense. So it reduces inflammation is the bottom line. So vitamin E, very, very effective to reduce inflammatory levels. And then pyridoxine or vitamin B6. So for women with PMS acne, that acts in a lot of different hormonal ways. Vitamin B6 may be very, very helpful to try and balance the hormones in those ladies. And then thyroid therapy has been found to markedly improve acne as well. There's topical treatments. We use tea tree oil externally to reduce bacteria and inflammation. It's really good. It's got tea tree oil leaves have antiseptic properties and actually have pretty good penetration throughout the skin and can actually deal with some of the skin irritation as well. And then we actually have azelaic acid. It's a natural antibiotic that is really active against P. acnans, one of the main bacteria that we find in acne. So when you look at like a 20% cream of that in one study I went through, it had effect in all forms of acne. Now applied twice a day for 4 weeks. It was continued for 6 months. But listen to this stat. 20% of this cream is effective as 5% benzoyl peroxide, hydroxychloroquine cream, tretinoin, which is a derivative of vitamin A, erythromycin creams, tetracycline cream. I mean, it was crazy, is that just this simple natural antibiotic outshine any of those treatments that we really do still see in the treatment of acne in the biomedical world. Since we were talking about vitamin E, it might be good to mention vitamin C has been shown some effectiveness too as a lotion. I always recommend the use of whole food vitamin C, as you probably have already known if you've listened to me long enough. And then nicotinamide, which is a derivative of niacin, really inhibits a lot of the enzymes and activity of the pathogens, these bacterial pathogens that affect the joint. So it can be very, very effective and well tolerated. Now, there's some treatments in Western medicine, non-medical treatments about comedone extractions and intralesional injections, putting, like I told you happened to me, putting cortisone right into the nodule lesion. It does take the so-called anger out of it. Of course, it's a steroid. But the problem is it didn't fix anything, and it's going to come right back again. And then there's other types of lights and lasers. Blue light has been found to be anti-inflammatory. We can usually use these procedures with cryotherapy or peels or microdermabrasion or epithelial exfoliation. All of that stuff is manipulating the skin to try and get out of the skin what we believe is a disease, when I'm telling you that it's coming from the inside out. And if you never fix that, whether you're using lasers or whether you're using microdermabrasion or whether you're seeing these spas for facial treatments, ladies, fix the root, and you're not going to be spending all that money all the time. You'll have a beautiful complexion if you really just get down to the root cause of the problem. I had mentioned emotional distress and maladjustment. Parents, children, insecurities, feeling of inferiority. That was what I was going through when I was a young teen. And it's important. So emotional stress, they say, oh, acne has not anything to do with emotion. And I beg you to believe that it is definitely involved in the presentation, because it develops as a disease progression from things like I talked about the gastrointestinal mechanism, right? What are young kids usually eating? Prime, low glycemic, high quality protein and good quality fat diets? No. My daughter came to me one time and she had acne, probably from me, right? Genetically, acne. And she was like, she tried all the benzoyl, and I just left her alone. I was, what does a dad know, right? Even though you're a physician. She just left it alone. And she goes, finally gave up. And she comes to me one time, I'm at the kitchen table, and she goes, Dad, I'm ready. And I was like, you're ready for what? She goes, I'm ready to listen to you. Isn't that a wonderful thing for a parent? And she says, I'm ready for the acne treatment that you had recommended. I was like, all right, we're going to start your acne treatment right now. Go back to your room, get on the computer and Google glycemic index. And I want you to look at all the foods that are on that glycemic index, and you can eat any food that's less than 30. So she went on and she came back about a half hour later and she goes, Dad, every single food on there that I love is more than 30. And I was like, go figure, right? Oh, she loves the bread. She loves the fried, the trans fatty acids. Despite parents, sometimes the kids are going to do what they're going to do, right? She actually did what I told her. We got her going on therapy. Again, within a week, a little over a week, her face was beautiful. The acne had started totally clearing. And so she was like, wow, this really works, right? Went right back to her old habits. What happened? Acne comes right back again. So this isn't something, especially genetically, that you can take just kind of blasé. You really have to be focused. You have to be committed. You have to be responsible for your own health, right? Emotional stress does play a huge part. We now know that our normal microbiota, our healthy bacteria, actually keep our intestines secure so that we're not leaking toxins into our bloodstream. They actually, when you do leak contents from the bloodstream, inflammatory bowel diseases or inflammation or low microbiota counts, you get in systemic inflammation that develops. As many as 40% of those with acne have low hydrochloric acid, inadequate stomach acid that allows a migration of bacteria from the colon up to the small intestine. And that permits this alteration of the intestinal flora, the microbiota. So what I'm saying is that intestinal health is the bomb, folks. You've got to address the digestion system. You've got to address this gut, brain, skin diet theory first before you get into all of the rudimentary Western drugs and skin creams and all that crazy. Fix the gut, heal the gut first. And that may be all that's needed. Tight glycemic control, good antioxidants, good microflora going on in a happy mood, all are conducive to ridding yourself of acne. Acne is such a multifactorial disease, including so much great natural therapeutic approaches. All that you need to do, folks, is be interested enough to say, I want this for myself. I want this for my child. I want this for my husband, my son. I want this. How do I get this information? How you get it is giving us a call, 772-398-4550, or online, get onto our website at traditionalchinesehealing.com, and where it says, click, I want to consult, fill out your information. I can do consultations over the phone. I can do consultations live. I'll do consultations out on my front bench if that's what it takes to get you into a better way to health, to break this habit of thinking that I have a disease, I need a drug, I have a disease, I need a surgical intervention, or I need a therapy. Start thinking more holistic, that these systems are all tied together. We went over diet, we went over supplements today, we went over some physical medicine, we went over some topical medicine. There's so many beautiful things, and I didn't even really dive into traditional Chinese medicine, of which I'm really the expert in, because there's such a plethora of great treatments in Chinese medicine as well. But you have to know the pattern in Chinese medicine. The pattern is dictated by, what does the pulse tell me? What internal organs are affected? What does the tongue look like? And diagnostically, I can nail that. Get a great Chinese diagnosis, no matter who you are, no matter what presentation of acne you have. Traditional Chinese medicine has had 2,500 years to think about this and provide effective treatments. So get in for the consultation, or let the phone ring in our office. I'm telling you, there's not only acne, there's so many beautiful treatments for so many devastating illnesses that people just do not know what traditional Chinese medicine has the capability of. Don't let these symptoms get worse. They will. If you don't treat this, it develops into nodules, it develops into deep-seated pustules, and ultimately scarring, unless you really address this quickly and naturally. And if I can't help you, I'll tell you I can't help you and refer you to those people that may be able to give you advice. Folks, this is a no-brainer. You've got nothing to lose by calling the office and saying, listen, I want a consultation for X, Y, or Z. What does Chinese medicine say about this? What is your result? What is your take on this? And what is your prognosis, Dr. Shipe? Because I'm all in. If you can give me a natural, non-drug approach, non-surgical approach dealing with my issue, I'm all in. I'm glad you're in too. Thank you for listening to the show today. I'm Dr. Stuart Shipe. I hope your week is blessed, and I will talk to you next week. Adios, folks.
Thanks for listening to A Better Way to Health. Discover health, wellness, and healing by booking your consultation with Dr. Shipe. Call 772-398-4550 or book online at traditionalchinesehealing.com.